I have insomnia. I'm on Synthroid, and my thyroid levels are normal. What's going on? Dr. Margie Egan with Just Between You and Me with Dr. Margie. Well, first of all, make sure that other causes of insomnia have been ruled out. And you can do that, your physician can do that. But let's say all of those have been ruled out. I mentioned in an earlier reel that our ranges, our lab ranges for laboratories, so TSH 0.5 to 5.5, that is for the majority of people. But some people fall outside those ranges. So they can be below or they can be above. So a normal TSH for you, let's say it was 1, that might be too high for you. Your body doesn't like it. And so what I would recommend as a simple try is just to drop your levothyroxine dose a little bit. So if you are on, let's say 0.075 milligrams per day, you could go down to the 0.05, which might be too drastic of a cut. More likely, I'm going to tell you to take your, and again, this is my medical opinion. Each doctor has their own creative way of doing things. But what I would probably do is have you do the 0.075 6 days a week and not take something 1 day a week. So take your med Monday through Saturday and nothing on Sunday. It's an art. It's really working close with the patient, adjusting the medication slightly, making that TSH go up closer to the 3 range or maybe even closer to the 4 or 5 range. It really depends on how your body is reacting and what level your body likes your TSH to be at. What's interesting with levothyroxine is some people convert that. Levothyroxine is T4. They convert a lot of it to T3, which is the active thyroid hormone. And if you're one of those over converters, you could have a higher T3 level, and T3 will cause you to be anxious, unable to sleep at times. So another thing someone could do is do a whole thyroid panel on you. Get your TSH, your T4, and your T3 level. And if they see the T3 level is a little bit high, then decrease your Synthroid dose. I kind of cut out the middleman. I'm like, why not just try to decrease the Synthroid dose a little bit and see how that would improve? Anything that is going to occur, it's going to take at least 6 weeks for you to notice a difference. So you have to be patient. Lastly is always take your Synthroid first thing in the morning, because if it is causing that insomnia, especially if you're taking it noon or later, you're just adding to the issue. So take it first thing when you wake up, put it right by your bedside, and just with a glass of water, just take your Synthroid and boom. And then you're done, and you just have to wait 30 minutes before you can have your cup of coffee.